Chapter 9, Ethical Aspects of Gerontological Nursing, from the text Gerontological Nursing, 9th edition by Charlotte Eliopoulos. Some of this material is review, as was the prior chapter on legal aspects to gerontological nursing. So we need to recall that we as nurses have a code of ethics that we are held accountable to, standards of practice that we're held accountable to, and that we should be using these documents as a guide for our actions. Review first the philosophies that may guide ethical thinking, such as utilitarianism, egoism, relativism, and absolution. And recall the ethical principles: autonomy, to respect individual freedoms, preferences, and rights; beneficence, to do good for others, for patients; confidentiality, to respect the privacy; fidelity, to respect our words and duty to patients; justice, to be fair, treat people with equality; non-maleficence is to prevent harm to patients; and veracity is truthfulness. Ethical dilemmas, or can be considered to lead to possibly moral distress. This is a conflict between one's own values and that of external that impact decisions being made. Remember the discussion on moral distress from professionalism. We must be aware of our own self's values and morals, and what may lead to moral distress, and get others involved as much as we can, and have non-judgmental acceptance. Changes in the healthcare system that increase ethical dilemmas for nurses are: the scope of practice is generally wider for nurses. Medical technology has raised the problem of knowing when to use these extraordinary type measures with genetics, artificial organs, etc. There's sometimes a conflict of interest. Discerning between prolonging life or providing comfort. The increased number of aging persons increase the times that ethical dilemmas arise. For example, the situation of honoring a patient's advance directives, but the families insist on the code, or prolonging life, and the provider supports the code or prolonging life. Measures to assist with ethical decisions: encourage patients to express their desires. Encourage patients and empower them to prepare their advance directives, to select a durable power of attorney. Speak to your patients about being consistent with what they're saying to others, and get it in writing. Document what you hear. Make sure that you are understanding what is being said. Identify significant others who impact and are impacted, legally if possible, but definitely know yourself. Read and stay up to date with policy and ethical dilemmas and processes in the hospital. For example, ethics committee. Ask to attend the meetings or be a member. Be prepared. Have discussions with experts, experienced health or related professionalisms, like clergy. A lot of persons will seek out the clergy to see what the trends are within the hospital institution. Consult to be comfortable with communications. Review Box 9.2 on assisting older adults with decision making.